For my presentation, I will be discussing the anatomical variations of the os trigonum. First, we will be discussing the anatomy. So as far as the positioning, it's strategically positioned just posterior to the talus. It's a feature in the anatomy of the ankle, and it provides support during movements involving the foot and the ankle. So its association with flexor hallucis longus, that is primarily what it's connected to, and it plays an important role in toe flexion and plantar flexion of the foot and ankle. This association supports the understanding of its impact on ankle functionality and support. So its variations are mostly in size and shape. It can be small or bigger. Sometimes it's oval shaped or round, and its size and shape can impact someone's biomechanics, and it may lead to variations in clinical presentation. For the function, it contributes to the biomechanics of the ankle, especially during plantar flexion. It's a bony structure for tendon attachment, and it enhances stability and movement. Understanding its function is vital in assessing how variations may impact movement, and it can lead to injury risks in the future. Anatomical variations, as I stated before, it can be different in size, small, medium, large, as well as the shape. It can be oval, round, or irregular. It mostly fuses to the talus, but it can fuse to other bones in the ankle, and its prevalence of variations is about 10 to 30%. So the prevalence is 10 to 30% in people. It can vary in size, shape, mostly associated with the flexor hallucis longus tendon. Its potential for asymptomatic presence, so most people that have it are unaware that they have it because it doesn't, most people don't know that it exists, or it doesn't cause any problems. And it can be a higher prevalence in certain populations among different demographics. It can be more prominent than others. Impact on blood pressure and venipuncture. The os trigonum doesn't have a direct impact on blood pressure. Being an accessory bone, its presence typically do not influence the cardiovascular system. Venipuncture may be complicated by the anatomical variations of the os trigonum. In some people that have it, the location and size of it can affect access to veins in the ankle and foot region. It may require alternative approaches or techniques during clinical procedures involving this. X-ray implications of the os trigonum variations. Standard X-rays may fail to detect small or subtle os trigonum variations due to their positioning. It's a very, very small bone, so sometimes physicians will have trouble to pick it up on X-ray. Advanced imaging techniques, MRI and CT scans do offer improved visualization, so sometimes this will be used instead of X-ray. It enables detection of both anatomical variations and associated pathologies. Clinical relevance. Accurate imaging is crucial for differential diagnoses in patients presenting with ankle pain. Sometimes patients won't have this bone, so it won't be related to the os trigonum, but oftentimes they will. Surgical considerations, pre-op imaging, particularly with advanced techniques, in order to detect this bone and see if it is causing any issues. Surgical approaches and considerations. Pre-op imaging, as I said before, utilize advanced imaging techniques such as MRI or CT compared to X-ray that won't pick it up as easily. So some indications for surgery. Assess the necessity of surgical intervention based on symptom severity and impact on daily activities. See if it's causing any problems or if it is present. Some surgical techniques explore various surgical options, including excision of the os trigonum to relieve symptoms. It can be removed if it is causing an issue. Post-op care, implement a rehab program to restore function and monitor for potential complications. If it does need to be removed or if it is causing any problems in a patient, a rehabilitation program can be utilized. And then these are my references. Thank you.